Welcome back to Sports Massage Therapy Education. In today's video, I'm going to show you how to apply transverse frictions to break down adhesions and reduce pain for your clients.
Okay, when it comes to transverse frictions now, it's going to be different to your typical kind of friction that we would normally do when we're at level 3. So a normal friction, you're going to kind of apply that pressure over that adhesion, you're going to go round in a circular motion. But with transverse frictions now, what we're doing is we're going 90 degrees to the actual fibre. So this is where good anatomical knowledge is going to come in. You'll need to know the way that the fibres run. So it's not just as simple as looking at, say, I don't know, the quads, and they all run that direction, because you're going to have some that come a little bit more internal, some that go more external, some are going to bend around ever so slightly. So especially when you're looking at things like on the back, you need to know the way that the fibres go before you start applying these techniques. One other thing as well to be mindful of when we're doing this, when you want to do a transverse friction to a muscle compared to a ligament, the muscle needs to be in a position where it's relaxed. However, if you want to do this on a ligament, the ligament needs to be taut. So you need to get it in a position where it's actually flexing and it's engaged. So what I'm going to demonstrate now is one of the ways in which I would do this over the patellar tendon now. So again, just bear in mind, it's going to be different depending where the adhesion is on the client. So adhesion being obviously anything from, say, just tightness or knots that are built up in the area to scar tissue. So it can be very effective in realigning those collagen fibers post-injury, but just bear in mind, the sooner you can get in there after that injury, obviously following protocol, making sure you're not going in the next day, give it at least the correct time period, but you want to get in as quick as you possibly can, because it's going to be easier to realign those fibers compared to when you go in a year, 2, 3 years down the line. So because I'm going to be doing it around here, I want to bring this just naturally into a flex position because I want it a little bit more relaxed. So knowing that the fiber is obviously going to run in this direction, if we're working on this kind of superior side of the patellar tendon, again, everything's 90 degrees. So I want to go against this now. So a couple of ways you can do this. One of my preferred method, I like to go 2 thumbs. And again, just working over this area. With transverse frictions, bear in mind, you want to maybe do this for around 10 seconds at a time. And then after, always follow it up with your effleurage. I always prefer to go in the direction towards the heart. So in this particular case, we're going to be going towards those inguinal lymph nodes. However, if you was working lower down, then obviously you're going to be going more towards the popliteal ones. And then again, kind of going back in. So obviously that was the 2 thumb method. Some people prefer to kind of go across using 2 fingers. It's whatever you feel you've got most control with. If I wanted to work kind of on the inferior side now, so below the patella, one of the ways in which I like to do this is using the web between the thumb and the finger, just holding the support on that superior side, and then just underneath here, kind of getting in and really working that area. So you can see I'm just getting in just below the patella there on this inferior part of the patellar tendon. And all I'm doing here is just holding and locking in that position. Gives me a little bit more control with that movement. And again, if we were coming in just here, again, that 2-finger method, you can come straight across. And this works really well for anybody with patellar tendinopathy. Another area that transverse frictions are going to be really effective is if you've got a client come in with either golfers or tennis elbow. It's going to allow us to kind of really get in on the tendons around here. So again, same principle is going to apply, the same as when you're doing the knee. It's exactly the same, just above the actual joint. Always, again, remember, 90 degrees against those fibers. Work for around 10 seconds. Always follow it with your effleurage. Again, in this particular case, we're going to be going towards the axillary ones just in the armpit region. So always follow up with that little bit of effleurage around there as well. But the other thing you can do here is, again, always remember, you can do this on the muscles. It's not just with focusing on tendons or ligaments. With tennis and golfers' elbows, a lot of the time the issues can actually be with the extensors in the arm as well. So what you can do, again, always a very, very small amount of oil. We want to be able to still get grip when we're going across. But again, you can work across, really getting into those extensors. Again, about 10 seconds. 20, I would say, is the maximum you're probably looking at going before you want to kind of get in an effleurage. And again, in this particular case, if we're referring to the lymph nodes, you're going to pass through those cubital ones first. Obviously, if you are following it all the way up, you will get to those axillary ones as well. And again, you can kind of work your way around all of this. But always remember, we're just going against the fibers. Now, just while we're focusing on this, one other method which can be quite effective is going in opposite directions. If you've got like an area where there's a real big adhesion, some scar tissue that you can feel that you're really struggling to break up, I sometimes find that working the two at the same time, going in opposite directions, can help break up that adhesion. Okay, so some common mistakes that therapists can make now is actually going with the fibre, which is effectively just stripping the muscle. So always make sure you're going against the fibre at 90 degrees. Also make sure you dab some of that oil off if it's too slippery. You want to make sure that you can actually get enough of a grip that we're going to be effective in breaking down that adhesion. And the other thing is going for too long. Make sure you're sticking around 10 to 20 seconds on the top end and always follow up with your effleurage in between.
To recap now, transverse frictions are a soft tissue technique used to break down adhesions, realign scar tissue, and desensitize local areas of pain and restriction. The key is in the direction. Instead of working along the muscle or tendon fibers, you apply pressure across the fibers using small, controlled movements. This stimulates healing, promotes circulation, and helps remodel injured tissue. You'll typically use this technique on tendons and ligaments where there's chronic tightness, scar tissue, or localized pain. You want to avoid this in acute areas of inflammation, fresh tears, or when the client is in significant pain. And when done correctly, this technique can restore mobility, reduce discomfort, and support long-term recovery.
And that is a wrap on today's video on transverse friction. So as always, if you've liked the content, don't forget to like, comment, and subscribe, and I'll see you in the next one.